Hey guys, it's Jeremy Pittman with Pittman Physical Therapy, and today in Ask a PT Anything, we're going to go over with one of the most common questions that I get asked on an everyday basis, and that simple question is, what is physical therapy? The follow-up question to that is, are you a chiropractor? So I want to talk about that just for a little bit and dispel a couple of myths. So physical therapists, are not chiropractors. We are not medical doctors. We are not massage therapists. So those are the things we're not. So now I want to talk a little bit about what we are. Physical therapists are now doctorate level practitioners dealing with muscles, skeleton, bones, joints, ligaments, and nerves. Now we are not surgeons. So what we do is we help the body to heal optimally on its own from a holistic approach. So what does that mean? If something is stiff, we help to make it move better. If something is tight, we try to loosen it. If something is weak, we try to strengthen it. If something is stuck, we try to get it to move better. So when you take all of those things in a combination with a really good evaluation to find out exactly what the mechanical problem is, then you can develop a plan to get you back to optimal health. Now that's all encompassing of several different things. So to move better, you definitely have to be able to be out of pain. So part of what we do is to help decrease pain through skilled intervention with these puppies right here, or we have some other tools and tricks that we use in the clinic. Now we don't give injections, we don't prescribe medications, we don't do any of those things, but we can do, in some states, depending on what state you live, we can do things such as laser therapy treatment or dry needling or spinal mobilization or manipulation. You can do those things that can help drastically reduce pain, inflammation, swelling, improve mobility, and get things moving in the right direction so that your body can naturally heal itself, because we're made to heal ourselves. A lot of times when you're taking a pill or medication, that's going to change your body's natural response to what it's supposed to do. If you're like taking an anti-inflammatory, for instance, yes, in severe cases of rheumatoid arthritis or degenerative arthritis, where surgery is not an option, a long-term anti-inflammatory use may be warranted. But in short bouts of acute pain, your body has this natural tendency to go through a certain process to heal itself. Well, inflammation is part of that process. So if we're constantly dampening the body's natural healing abilities, then it's going to take time, take a little bit longer to heal, or maybe those structures aren't going to heal quite as strong as they should have healed. So what physical therapy does, I hate to even say the word physical therapy as a thing. What physical therapists do is we thoroughly evaluate, and this is a big word, the musculoskeletal system, or your body from a muscle, joint, bone, ligament perspective, to figure out exactly where your imbalances or dysfunctions are. Now, when I say that, it might sound, kind of hocus pocus, kind of iffy, but you could have shoulder pain that may or may not be stemming from the shoulder itself. It could be another body system that's causing that problem. And for an example, this is what I always like to say is if you're having a heart attack, heart being a muscle, deep inside the left side of your chest, you can have left arm pain. You can have facial numbness. A lot of females will have lower back pain, okay? Well, that's a referred pain, or it's pain in one area that's not coming from that area. So if you went to the doctor and said, I'm having arm pain, and they didn't do a thorough assessment to find out you were having a heart attack, you could die, right? Well, we're not dealing with anything that serious, but if you're having knee pain and you come in and all we do is treat the knee when it is coming from your back, then you're not going to get the results that you want. So after a thorough evaluation, we don't follow pain. Pain tells us a symptom. We find the cause, treat the cause, you get better. So in a nutshell, what physical therapy is a use of the mind and skilled, thorough assessment, hands-on treatment approach to help your body heal itself from a natural, holistic standpoint and try to get you back doing what you love. Okay, so our goal, our mission is always to get you back to doing what you want to do. Like, so if you're a golfer, we want to get you back to golf. If you want to play with your grandkids, we want to get you able to play with your grandkids. If you just want to garden, we get you back to garden. If you're a high level performance athlete, we want to get you back to your sport. No matter what it is, there's ways to optimize your body, your strength, your flexibility, your mobility in order to help you achieve those goals. So I know I got a little bit long-winded. Next time we're going to continue with the what. Until then, stay safe and stay healthy.